Oh yes, this is your sliding knee flexion stretch, used very often after surgery because the knee gets stiff. Sometimes we also use this, maybe you have some swelling where you've injured the knee and you can't move it well. Find somewhere slick. If all you have is carpet in your home, you can use something slick to put your foot on. It might be a board with a towel, or you might use something like a cookie sheet, okay? So the knee's going to be stiff, so I don't expect you to do just all of this just with the power of this leg. You can add this foot on the object that's sliding, or you can also put on the front of your leg and help to push back. Then really try to relax this leg. This leg is then pushing it back. You can also use your hands. You can see I'm going at this exercise relatively slowly. We want you to get into where it's kind of painful or stretching, and then you want to stay in that position. You might even add a little bit more resistance as you're trying to stretch. Stay in that stretch 5, 10, 15 seconds at a time. Again, if it feels like you could get it a little bit more, try to come back a little bit more, okay? We like to minimally have you do this 20 to 30 reps, okay? Or I'll tell someone to set a timer, 3 to 5 minutes, and really sit and work on this stretch. I'm not trying to decide. One more thing about this chair. You can see this chair doesn't have any legs or anything underneath it, so that's also something you have to find. If you get stuck on something here, then it's very difficult to complete this exercise. You also want to pick a chair that's pretty level, so I'm not sitting up too high, and you want to use the same chair every day, okay? I'm going to turn to the side, and you can see this. So as I come back, I'm going to add this, I'm going to drop back, and I'm going to try to stretch, okay? The other thing I tell my patients is that use the same setup every day. So, and you can kind of make a mark. Where did I get to yesterday? You need to make a gain today. So I'm going to slide this back. There's my mark. I've got to get past it today. I'm going to work on getting this farther and farther back. Stretching, holding. Get that stretch. If you have some discomfort, it's okay to put your hands. Maybe sometimes the rubbing can help with the pain as well. Again, we want you to do this many times during the day. I say minimally, you need to do it with your meals, but really, realistically, 5, 6 times a day, it might be 8 times a day. At least 30 repetitions or 3 minutes, and really work on getting this stretch. That is your knee flexion stretch.